Hello, and welcome to the Neonatal Intensive Care Unit at UR Medicine Golisano Children's Hospital. We are committed to providing quality care for you and your baby. Part of that commitment is to reduce the spread of germs that can make your baby sick. And since your hands carry germs you can't see, the best way to prevent the spread of infection is by washing your hands. Something all of us spending time in the NICU need to do. After you check in with the NICU secretary and before you fully enter the unit, we ask that you please complete a 3-minute hand scrubbing with the sponges provided. If for any reason you are unable to complete this, please speak with your baby's healthcare team for alternative solutions. To start, we ask that you remove any rings, watches, or bracelets and roll up long sleeves above your elbows. After opening the scrub brush, wet the brush and scrub your arms up to your elbows, making sure you create a soapy lather. If you have long nails, you should use the blue nail cleaner to clean underneath them. Not only are you completing this 3-minute scrub, but all members of your healthcare team complete the same steps as well. Your child is our priority, and quality care begins with proper hand hygiene. Please don't hesitate to ask your nurse or other member of our NICU any questions you may have regarding hand washing. Clean hands are healing hands.